Caregiving for elderly Americans can be a huge expense in time and money for their loved ones. A new report shows 20% of all caregivers say they spend more than 40 hours a week providing that help. For many, that's about the equivalent of a full-time job. Close to 8 in 10 pay for the costs out of their own pockets. In 2016, Dr. John LaPook asked caregiver Mike Daly about the expense of supporting his wife, who battles Alzheimer's.
If you did want to retire, could you swing it financially?
No. I had to dedicate my whole life to taking care of Carol because I couldn't afford to pay home care.
What would you say the toll has been on you?
I'm dying. I really took a hit. My blood pressure is like 200 over 100. I can't go to the hospital. Who watches Carol?
CBS business analyst Jill Schlesinger is here. Good morning. I so remember that story, and Mike Daly ended up putting his wife in a nursing home. Why are so many burdening the costs of this caregiving?
You know, when you think about it, we are living longer, but there's also something different happening in families. We're geographically dispersed, and that means that maybe 2 generations ago, our family members would move in with us. We'd all pitch in and help. Now the burden is falling disproportionately, usually to the person closest to your loved one. And oftentimes, about 2/3 of the time, that ends up being the woman, whether it's her family or not. Look, there's a problem here. On one end of the spectrum, if you have a lot of money, you can pay for care. At the other end of the spectrum, you may qualify for Medicaid. That's for the people who are poor enough to qualify on income and assets. But those in the middle, boy, they are crunched, and it is burdensome.
Do employers offer assistance for caregivers?
This is starting to actually become more prevalent. So larger employers, they have certain benefit options. Maybe it's a discounted price on senior helpers. It could be groups that are helping you. Some have paid leave, but more and more, I think this is going to have to be part of our employee benefits because it is impacting millions of Americans.
Do you think long-term care insurance is something that most people should consider?
Well, I think it's very difficult because, number one, it's incredibly expensive. For people who purchased long-term care insurance, there's a huge risk because premiums have been rising. These long-term insurance companies mispriced these policies. They go petition states. Those premiums can go up by 30, 40, 50%. And frankly, this is an exorbitant cost for many American families. So that is why we are seeing the prevalence of these informal caregivers. And so important to talk to your family members while they're well. I cannot encourage that enough.
Talk to them and say what?
Well, I think you need to find out from your parents, number one, what kind of care do you think you would want? How are we going to manage this as a family? You know, it doesn't fall equally among siblings. Some siblings may be actually financially able to help. Some may be able to physically help. And maybe you need to have, as a family, a broader conversation. It's really hard. I understand that. My father died 5 years ago, and I have one sister, and we were on the same page the whole way. When you have lots of family members and they don't all get along, it's very difficult. But having the conversation is your first step. Finding out how much money your parents have, make sure that they are not preying, that predators are not preying on them, and be very aware that this is something that is likely to impact, get this, 70% of Americans who are 65 will need some form of long-term care.
Important message. Thank you.
It is.
Time to start thinking about that. Thank you very much.